The opportunities we would like to bring to this community is the multiple services that we could provide in this clinic. One is with the dietitian. The dietitian can help provide a meal plan, different resources, and also just samples of different types of food and meals that a patient can easily put together to keep their blood sugar under control. Other specialties within this population is also with the nurse providing teaching to the patient in regards to how diabetes work, how it affects their health and their bodies, and how it relates to other comorbidities that the patient might have. We hope to provide support to the physicians locally in the surrounding area, and to also hope that the physicians will provide support to our clinic with referrals to help serve this population. Diabetes is such a complex diagnosis that it needs a lot of care and attention to keep under control, and for the patient to also stay compliant. Now I want to talk a little bit about value-based care. Value-based care is a quality outcome measure in healthcare that shows the best outcome for low-cost care with high-quality outcomes. Outcomes that are reported will foster improvement of best practices in healthcare. Value can be created within certain clinical conditions over the full cycle of care that involves different specialties. Success can be achieved when working as a team that centers around the patient's clinical condition. Value-based care is a model that revolves around the patient's treatment. It is a team approach to provide coordination of care to improve the patient outcomes. The first quality outcome measure that could demonstrate the success of the Azusa Regional Medical Center outpatient wound clinic program is the admission rate to the hospital. From my experience, when a patient experiences a symptom or issue that they are not familiar with, what usually happens is that they would go to their emergency room to get the issue checked out. If the patients are given the time to go over the care, know what to expect and what to do when a symptom arises, the rates of these patients going to the emergency room could decrease, which in turn will decrease in admission as well. Also, if the patient has a clinic that can answer their questions over the phone, this could provide some ease to the patient and also give them advice, which could in turn lead to decreased use of the emergency room. Readmissions for the same diagnosis could affect the reimbursement for the hospital. Readmissions could easily be monitored to provide the hospital what type of diagnoses are resulting in a readmission and what was missed when the patient was discharged. If the readmission rate for the diabetic wounds have decreased over the year when the clinic runs, this will be a good sign that the outpatient wound clinic is successful. The second quality outcome is the patient experience. When the patient is given treatment in an acute hospital, the patient may have a lot of anxiety and may not always understand the instructions for their wound care. In an outpatient setting, the patients may have less anxiety and may be able to feel more comfortable with the instructions and treatments that are provided to them. This would provide a more realistic gauge of patient satisfaction. In an outpatient setting, the wound care session could feel less rushed, which would provide the opportunity for the patient to ask questions and ensure that they understand. In the beginning of when the patient starts coming to the clinic, they can come back for a few days consecutively or come every other day to allow them to start learning to do their own wound care treatment. Repetition will allow the patient to better understand the steps in their wound care treatment plans. When a patient's wound starts to heal in the right direction, the satisfaction score should improve. The patient would have more confidence in his or her own care and to be independent.